KTN.
To the health sector now, a labor crisis has hit the country's largest referral facility, Kenyatta National Hospital, after nurses downed their tools over long-standing grievances. The strike has disrupted services, leaving numerous patients stranded. The hospital's management today confirmed that staff salaries, including those of nurses, had been processed and paid up to March 2026, following recent engagements with union representatives. This in addition to hiring temporary nurses to help patients in the wards as the negotiations with the striking nurses continue. However, despite these assurances, nurses have vowed to stay off duty until their grievances are fully addressed. Our reporter, Catherine Imuraget, has more on this.
Services remain paralyzed and patients left stranded across the multiple departments at the Kenyatta National Hospital. This comes after nurses downed their tools at the health facility over unresolved labor issues. They began feeling the impact as early as 7 a.m. on Monday.
The refusal to implement agreement in bracket CBA addendum dated 8th September 2025. The item number 2 is unsatisfactory medical cover. Kwa hivyo kazi imetuzidi na wagonjwa wetu hawapati matibabu kwa kiwango ambacho kinastahili.
The nurses say their decision follows months and in some cases years of unaddressed concerns that include delayed salaries and remittance of third-party deductions, stalled promotions, increasing casualization of staff, inadequate medical cover, and ongoing staff shortages. They also add that difficulties in accessing pension contributions have significantly affected their livelihoods.
Where is our pension? Are we going to work for 30 to 40 years in this hospital and then we go home with nothing, with 21%? If that 21% is what we worked for 30 years, is it worth working for? No! Is it worth working for? No! Where is our 79%?
The industrial action is expected to disrupt critical services rendered within inpatient wards, outpatient clinics, and emergency units. This is gravely affecting patient care. However, the hospital's acting chief executive officer, Dr. Richard Lesiampe, says the institution's management has acknowledged the grievances and is engaging stakeholders to resolve the matter. Lesiampe says salaries have been paid up to March 2026, adding that delays in statutory deductions are linked to structured remittance processes tied to cash flow cycles.
Kenyatta National Hospital confirms that all staff salaries, including those of nurses, have been processed and paid up to March 2026.
Lesiampe further says that several nurses have transitioned to permanent and pensionable terms, with discussions ongoing to address remaining cases. The hospital has also moved to hire temporary nurses to cushion patients as negotiations continue.
We have deployed all our management nurses. We have got not less than 300 nurses in management, and they are actually the ones we have deployed to all very, very critical areas. And we have mapped out particularly critical areas so that we do not lose lives.
In his address earlier today, tensions briefly flared, with some nurses rejecting some of his remarks and others even walked out. Despite crisis deepening at the Kenyatta National Hospital, nurses have officially started their strike today. They are vowing not to return to work until their grievances are being met. Catherine Imuraget, KTN, Nairobi.
To politics now, where President William Ruto